All right, we're going to be talking about antihistamines and respiratory pharmacology. To get started with antihistamines, we should talk about allergies. Allergies include stuff like sneezing, coughing, itching, headache, congestion. All of those are indicative of allergies. A person, for any allergy, you first have to become sensitized to that allergen. That allergen is going to have some sort of antigen that the body's going to respond to. And so your body will come in contact with something and be like, I think this is a harmful particle. We should kill it. And so you make antibodies against that allergen. And that allergen or antigen can be pollen, mold, insect venom, like whatever, right? The antibodies that are made increase each time with every introduction to that antigen. So you'll start off with just a few plasma cells that make the antibodies against that allergen. If you come into contact with it again, then you're going to have an allergic reaction. And then if you contact it again, you can have an even stronger allergic reaction. And each time you come into contact with these allergens, you can have stronger and stronger allergic reactions. That's not always the case, but it is potential. And then you can get anaphylaxis if coming into contact with that allergen causes cardiovascular or respiratory failure. The reason for all this is histamine. So we've talked about histamine in the past, right? That gets released from these mast cells, from basophils. You're going to find a high concentration of mast cells in the lungs, the GI tract, and the skin. And so where you see most of your allergic reactions are going to be breathing impairment, GI dysfunction, or skin irritation, right? Like hives. So what happens is your body comes into contact with an allergen. That allergen is going to be bound with antibodies. The antibody that specifically binds allergens are going to be your IgEs. Those IgEs will be found on your basophils, your mast cells, and they'll activate them. And it'll cause something called degranulation. With degranulation, so these are granulocytes, so they have these little particles all throughout them. And they get rid of them really quick. And inside those particles, you're going to have histamine, you're going to have heparin, you're going to have serotonin, prostaglandins, leukotrienes, and some things called eosinophil activating factors. And those do exactly what they sound like. They're going to activate eosinophils and bring more eosinophils here to attack whatever this allergen is. And it's kind of like a positive feedback loop where it's going to get a stronger and stronger reaction because you're going to bring in more and more white blood cells to this area to cause the inflammation. Typically, your allergic reactions are going to be acute hyposensitivities or type 1 allergic reactions. And that's because they have immediate onset as soon as you come into contact with that allergen. Some drugs like morphine can also cause like allergic reaction. They can cause degranulation of mast cells, but it's not that you're allergic to the morphine. Some people are, but it can cause like an allergic-like reaction because it causes the degranulation of mast cells. There are 4 receptors for histamine. Your histamine 1 receptors, these are going to be located on your blood vessels. They're going to be located on your bronchial smooth muscle and in your intestinal smooth muscle. These are typically the receptors that you're going to see associated with allergic reactions. So these are going to be the ones that are going to cause the anaphylaxis. That's going to cause the respiratory difficulty. That's going to cause bronchodilation, because that's kind of what histamine does and heparin does, is, or not bronchodilation. It's going to cause bronchial constriction, but on your blood vessels, it's going to cause dilation. And so that's so those vessels can open up, right? Especially those capillaries. And so you can get the blood cells out into the tissue to fight whatever that allergen is or infection or whatever it is. Your H2s, these are going to be located in the stomach, heart, blood vessels, also in your uterine tissues. They increase gastric secretion, and we'll talk about these more in some future chapters. We're not going to really focus on them right now because they're not really associated with allergies. But whenever it comes to like heartburn, you'll have some that interrupt these histamine receptors. H3s, these are going to be found in the brain, and then your H4s are associated with your white blood cells, specifically your neutrophils, your CD4s, and your T cells. And any drug that is antagonistic to these histamine receptors or prevents the binding of these histamine receptors is going to be an antihistamine. If they work on the mast cells themselves to stop them from degranulating, those are called mast cell stabilizers or anti-allergic agents. Just a little clarification there. So the effects of histamine. It's going to cause your blood vessels to dilate, right? Especially your small blood vessels, your capillaries. If they dilate too much, it can cause a circulatory collapse, which means there's not enough blood returning to the heart to pump. And so you have anaphylaxis, right? Dilation in your cerebral blood vessels can cause a throbbing headache. Each time your heart beats, it feels like your head's going to explode. In the smooth muscle, it constricts the bronchioles, so it makes breathing more difficult. And in the intestines, it can result in diarrhea. Cardiac muscle, it increases your heart rate until you go into shock, right? And then it stops. So here you can kind of see like your typical allergic reaction. Your lacrimal glands will give you teary, watery eyes. Your blood vessels will dilate, and so your eyes will be red and itchy. That extra tears that is being produced also causes you to have a runny nose, but you also have the dilation in your nasal epithelium, which causes your nose to become congested. And so it's like congested, you can't breathe really well, and it's runny because you have this extra fluid leaking out of it. And so you get the kind of sniffly, watery eyes that are really itchy. Dermally, you can have hives, right? So with our antihistamines, or our H1 antagonist, there's a whole bunch of different ones. We're just going to kind of touch on a few of them and really talk about them based on their generation. All your antihistamines are indicated for your relief of your acute allergic reactions, right? So those ones that are onset with the introduction of that allergen. So over here are our different types of antihistamines. Some of the ones that you'll know more would be like your first generation antihistamines. Benadryl, right? Benadryl or diphenylhydramine. This is kind of the go-to antihistamine. Others in this group like meclizine, brompheniramines. There's a lot of your first gens. All these are non-selective histamine antagonists, so they're not just specific for your H1s. And so they can cross the blood-brain barrier. They can affect those H3s, which can cause sedation. Some of them are also local anesthetics, especially Benadryl is a sodium channel blocker. So it blocks your voltage-gated sodium channels and acts kind of like a local anesthetic. So you can put it on a mosquito bite. It's lipophilic, so it can work across the skin and get to those nerve fibers and block the itch that is associated with it, while also working on the histamines and blocking them. Some of them also have anticholinergic activity. Meclizine can relieve vertigo and motion sickness, and so you'll see that. You see some antihistamines in your vertigo or motion sickness pills. Cyproheptadine also doesn't, it inhibits histamine, but it also inhibits serotonin. And if you remember, some of the things that your mast cells release are going to be histamine and serotonin and heparin. And so this one kind of has a stronger effect against the allergic reactions. But still, the go-to tends to be Benadryl. We had a second generation of antihistamines come out. Terfenadine is one, but they're pulled off the market. You don't see these advertised anymore because of cardiac safety reasons. They would cause heart failure, which, if you're having an allergic reaction, you don't want to have heart failure too, right? But your third gens, these are typically the ones that you take as like a daily antihistamine, right? So Zyrtec, Allegra, these antihistamines are safe. They're long-acting. They can work throughout the day, right? And they're more selective for just your peripheral H1 receptors. And that's why you don't have the drowsiness associated like you do with Benadryl. Your third gens don't work any better than Benadryl does as an antihistamine, but they do work without causing that drowsiness. A lot of these are over the counter. For the longest time, Zyrtec was prescription only, but it is now moved to over the counter. For drugs to go from prescription to over the counter, there's like a couple of different steps that you have to go through. One, the patient has to be able to self-diagnose correctly what the issue is. Two, they have to be able to successfully treat that condition with the medicine. And so you don't see a lot of like subcutaneous or IV medicines that are going to be over the counter because typically you can't do that successfully, right? And then it has to be safe. So the product has to be safe within the recommended doses, and then it can start being over the counter. Something else you'll probably see or notice is some of these antihistamines you will also find in cough and cold medicines because they do help with that congestion, runny nose, because of the release of histamine. We'll pick up in the next one talking about mast cell stabilizers.